I'm Deborah Wafer, and you're tuned in to Rolling Out.
Hey, Rolling Out family, welcome to Health IQ. I'm your host, Eddie Precise Lamar. Today, I'm joined by Deborah Wafer, Executive Director of Public Affairs at Gilead Sciences. Today, we're having a powerful conversation on HIV among Black women and how we can help drive awareness, prevention, and access. Let's dive in. How are you?
I'm fine. How are you doing today?
I'm awesome.
Good.
So I'll just jump right in. So Black women account for over 50% of new HIV diagnoses among women in the U.S., but only 8% of PrEP users. What is Gilead doing to bridge this glaring gap in prevention?
We're doing things like today we're at the National Medical Association meeting, raising awareness among clinicians. We have programs that we are funding with organizations that are doing work in the communities to educate Black women. We are working with universities. We are doing lots of work in lots of different places and spaces because we know that this is a message that's not out there, and we want to make sure that people are learning about it in a culturally sensitive kind of manner and not just a clinical manner.
Indeed. So how is Gilead working with these community-based organizations to reduce the stigma and increase awareness about PrEP options among Black women?
Well, stigma comes from lack of information and lack of education. So we're trying to clear up the misinformation that people have about HIV prevention, about people living with HIV. And again, we're trying to do that in different places and spaces. So we're doing it with community-based organizations. We're doing it with organizations that are focused on women's health. And we're doing it with organizations in the arts and trying to speak to people not just clinically, but culturally around HIV and getting more women to understand. If we get women involved in this epidemic and in this education, we know that they can spread it in their communities and that they are the trusted voices about health in their families. So we're trying to do this on multi levels, if you will.
Indeed.
Yeah.
So lastly, with the advancement of long-acting injectable PrEP, how is Gilead ensuring equitable access for Black women who may face structural barriers to traditional healthcare systems?
That's a big question right there. So I think one of the big issues is people knowing what PrEP is. Because a lot of people even don't know what PrEP is. If you don't know what PrEP is, you don't know how to access it. So we're trying to raise awareness about what PrEP is and dispel any of the misinformation around PrEP, so that folks know who to talk to about it. And I think amongst ourselves is very important to have the language to educate the people in our community about.
Thank you so much, Ms. Wafer. How can people learn more?
You can learn more by going to GileadHIV.com. You can also learn more about going to AIDSview.com that has information that is down to the zip code. You can learn about HIV in your city and in your zip code. So those are the two resources that I would.
Yes. Rolling Out family, make sure you tap in. Once again, this is Eddie Precise Lamar at Health IQ. And as I always say, stay focused, positive, and productive. Peace.